Now, the coronavirus pandemic continues to test our nation in new and difficult ways. There's now a confirmed case of coronavirus in all 50 states and the District of Columbia. Our public health system was understaffed and under-resourced, and without intervention, it could soon become overwhelmed. Even as the market shifts from day to day, the coronavirus is slowing our economy to a near standstill, and we're almost certainly anticipating a recession. You go to the streets of many cities, towns, and villages. They're empty. Schools are closed in large portions of the country, and businesses are struggling not to lay off workers because they don't have customers, they don't have clients, they don't have income. So there's a great urgency here, and there are really two separate and simultaneous emergencies, one in our healthcare system and another in the economy. We have to deal with both, and if we don't solve the one in our healthcare, the economy will continue to get bad no matter what we do for it. Less tangible than those two emergencies, but still very real, is the impact the virus is having on American society. My home city of New York is effectively on lockdown. You can go to a place like Times Square Station, subway station, and see nobody, actually nobody there. Americans are being asked rightly not to gather in groups of 10 or more, not to go to dinner or to a bar or to their church or place of worship. Now, Madam President, I have lived through 9/11. It occurred in my city. I knew people who were lost. I lived through the days of the financial crisis in 2008 and other moments of national urgency. But there's something much worse about this crisis we face. I have never sensed a greater sense of uncertainty, a greater fear of the future, of the unknown. We don't know how long this crisis will last. You don't even know if you've contracted the virus right away, or maybe your spouse, maybe your child, maybe your parent, maybe your friend. And then there's a much greater sense of isolation, a problem for which there is no cure. I miss not meeting and talking to my constituents. They're our lifeblood. Well, that's not just happening to us here in the Senate. It's happening across America, friends who used to get together, families that had gatherings. Different social activities are gone. Book clubs, card games. The fabric and sinew of our lives as human beings has been put on hold, and nobody knows for how long. By necessity, Americans are now sacrificing their normal lives and daily routines, and maybe worst of all, sacrificing a sense of community, because we all, each individually and together as a country, must fight this awful virus. And unfortunately, we're only just beginning to see the necessary seriousness and mobilization of resources from the federal government. Sadly, unfortunately, and with awful consequences, this administration took far too long to wake up to this global crisis, wasting precious weeks downplaying the severity of the coronavirus that could have been spent in earnest preparation, building our test capacity. As a result, the United States continues to lag behind other countries in the number and the percentage of the population we are testing. Stories of Americans who feel sick and are showing symptoms but are unable to access a coronavirus test appear every day in every single newspaper. Warnings of a potential shortage of masks, hospital beds, and ventilators appear in the paper every day. In 2 weeks, the issue of ventilators and ICU beds will be like the issue of tests today. In other words, 2-3 weeks ago, many of us were saying, get those tests out. A month ago, people were saying it, and now we're seeing the consequences. Lockdowns, because we can't test people. We don't know who has the virus and who doesn't. Well, the same crisis will be occurring in a few weeks. Mark our words, unfortunately, it's true, about ventilators and ICU beds. We're behind the 8 ball on tests, and we're soon going to be behind the 8 ball on ICU beds and ventilators as more and more people get sick. The administration didn't pay attention to tests, and now we're paying the price, even though many of us were hollering for weeks about the emerging issues with testing. Well, the same problem's about to happen with ventilators. We know that in 2 weeks, the number of ventilators might become a massive problem. We must get ahead of it, and get ahead of it now. I'm calling on President Trump to use his existing authority to help address the widespread shortages of medical equipment, particularly ventilators, as a result of the COVID-19 outbreak. I joined 27 of my colleagues in a letter to President Trump urging him to invoke the Defense Production Act of 1950, which authorizes the President to strengthen domestic manufacturing capacity and supply in extraordinary circumstances. It's used in times of war. Well, we must mobilize as if it were a time of war when it comes to hospitals, beds, supplies, equipment. And the DPA, the Defense Production Act, allows the President to direct the production of private sector firms of critical manufactured goods to meet urgent national security needs. The President should do so immediately. Today, a report came out that the Army Corps of Engineers and FEMA are ready to and willing to participate in the response process. The Army Corps could build temporary hospitals with beds, but they still haven't received instructions from the White House, from the administration. I thank the men and women willing to be on the front lines combating the pandemic, but this kind of inexcusable action is maddening, infuriating, and must be rectified. Lives are at stake. Public health infrastructure is the top priority, because if we can curb this virus, the economy will get better. We need to do things to help it, obviously. But if you ignore the public health crisis with the equipment and infrastructure and personnel that is needed in many more numbers than we've ever seen, the economy won't get better. So, the legislation passed by the House on Saturday, phase 2 of the coronavirus response, is a little bit of this, and that must pass the Senate today. But unfortunately, first we must dispose of a Republican amendment that would make a condition of the bill a requirement for the President to terminate military operations in Afghanistan. Yes, you heard me right. Our Republican leadership has put on the floor an amendment that would make a condition of the bill a requirement that the President terminate military operations in Afghanistan. In a time of national emergency, this Republican amendment is ridiculous, a colossal waste of time. We probably could have voted on this bill a day or two ago if not for the need to schedule this amendment. I'm eager, we are all eager, to dispatch this absurd Republican amendment and send this bill to the President. It allows, for instance, for free testing and treatment in coronavirus, very much needed. We can send this bill to the President and begin work on the next phase, phase 3. Now, as my colleagues know, Senate Democrats have already outlined several proposals for the next phase of legislation, and the specifics have been made public. The proposal has 4 main priorities: public health capacity, unemployment insurance, paid sick leave, and priority treatment for labor in any bailout to industry. There are many things in this bill that are important: paid student leave, no payment on student loans or mortgages, help with our mass transit systems. There are many things, and Democrats are going to fight for them in the next phase of the response. But the priorities I mentioned are key: public health capacity, unemployment insurance and paid sick leave, and priority treatment for labor and any bailout to industry. On the public health capacity, as I mentioned, we need masks, we need hospital beds, we need ventilators, we still need testing kits. And so, Democrats are proposing a Marshall Plan for our public health infrastructure. The sooner we act on it, the better. We also need to help, in terms of our health care system, public transportation. Tens of thousands of healthcare workers in New York City and many other cities cannot get to their jobs, their very needed jobs, if there's no public and mass transit. But a Marshall Plan for our public health infrastructure is what is needed now. And it will prevent the situation from getting even worse, and it will allow our ailing economy to begin to heal once we contain this virus. Workers who get laid off or have their hours expanded or have their hours cut to almost nothing need expanded unemployment insurance, period. Yesterday, the Secretary of Treasury reportedly told Republican senators that unemployment could hit 20%. Unemployment insurance is a non-negotiable part of our response to the coronavirus. And paid sick leave. Senators Murray and Gillibrand have a paid sick leave policy to meet this crisis. It should be added to this part of the legislation. I think they will ask a unanimous consent request or offer an amendment to do so. If it's not included in this part, it should certainly be included in the next phase of legislation. Now, there will be other items that we have to address down the road. Certainly, certain industries are struggling, airlines, hotels, but we must make sure that we prioritize public health and workers over corporate bailouts. And if there's going to be a discussion about a bailout, it must include worker priorities and protections. The airlines are very important, for sure. They employ a lot of people. Many of us who fly back and forth to our states know what the good people who work as the pilots and the flight attendants and the mechanics and the clerks and the ticket takers. They're good, fine people. We want to make sure they're protected. And one of the reasons, let's not forget, that many airlines are so short of cash right now is they spent billions on stock buybacks. Money they had to send out when they should have been saving it for a rainy day for their workers and customers. That issue should be addressed. Now, a few of my Republican colleagues have proposed a one-time cash payment of $1,000. But my fellow Americans, this is not a time for small thinking. This is not a time for small measures. This is a time to be bold, to be aggressive. A single $1,000 check would help someone pay their landlord in March. But what happens after that? How do they pay their rent in April when their office or restaurant or store is still closed for business? How about May? How about June? The president suggests that this recession could last through the summer. $1,000 goes by pretty quickly if you're unemployed. In contrast, expanded unemployment insurance, beefed up unemployment insurance, covers you for a much longer time and would provide a much bigger safety net. This is time to put tribalism aside and acknowledge that this recession, if we allow it, would do real harm to Americans up and down the income scale, and it will hurt Americans of all ages. So, if we're going to provide direct payments, they need to be bigger, more frequent, more targeted. Millionaires shouldn't get them. Now, these are the kinds of issues that all parties are going to have to discuss. Democrats and Republicans, House and Senate, and the White House. The sooner we discuss them together, the quicker we'll be able to move forward. But Leader McConnell announced yesterday that his plan to develop the next phase of legislation would be first for Senate Republicans to sit among themselves and then sit down with the administration and come up with their own proposal before presenting it to Senate Democrats, let alone House Democrats. The process that Leader McConnell has outlined for Phase 3 legislation is too cumbersome, too partisan, and will take far too long, given the urgency and need for cooperation. Secretary Mnuchin says he wants legislation passed by the end of the week. The McConnell process will not get us there. Phase 3 legislation should be the product of a five corners negotiation: House and Senate leaders, majority and minority, plus the White House. That's the way that's worked the best, the quickest, the fairest in the past. If all parties are in the room from the get-go, the final product will be guaranteed swift passage. The process Leader McConnell outlines is far too reminiscent of the typical legislative process in the Congress, a process that far too often results in delay and gridlock. We can't afford that right now. Leader McConnell was right when he said that in times of national emergency, we must shed our partisanship and rise to the occasion. So let's begin that way. Republicans and Democrats, House and Senate, Congress and the White House. The best way to advance Phase 3 legislation is to have a five-cornered negotiation from the outset. I yield the floor.